It's the age of gadgets, and if there's one gadget that most of us cannot live without, it's our cell phone. It keeps us in touch, it entertains us, and it keeps us on track. But could it be affecting our health? Here to discuss cell phone elbow is Dr. Khurram Pervaiz. Yes, cell phone elbow. He's a hand and upper extremity surgeon at Orthopedic Associates of Central Maryland. Welcome so much for being here. We appreciate it. So, okay, cell phone elbow, it kind of sounds even silly to say, but it's serious.
Cell phone elbow is a condition that involves a pinched nerve around the elbow. The ulnar nerve that travels on the inside of the elbow can get pinched and irritated, and that leads to cubital tunnel syndrome, also known as cell phone elbow.
Now, besides the obvious, which is you're in pain, so you know something's wrong, what are some of the other symptoms and signs?
Patients will usually have numbness and tingling that shoots down from the inside of the elbow into the pinky and into half of their ring finger. In more advanced cases of the disease, they can have muscle weakness, muscle wasting. People may start dropping things or have loss of ability to do fine motor control, such as holding a pen.
So instead of dropping calls, you're actually dropping the cell phone?
You might be dropping the cell phone, yes.
So, okay, so cell phone elbow, how do we deal with this? Because we're not going to stop talking on our cell phones. Earpieces, is that?
Yes,
okay.
So that's one of the things that we can do. In early stages of the disease, where it's not so severe, you can wear a special brace at night that keeps your elbow straight, resting the elbow, avoiding too much elbow flexion, so having your elbow sort of not bent for a long period of time, using a hands-free. This has been shown to make a real difference in the early stages of the condition.
Now, have you already done surgery on something like this? Have we been using cell phones long enough?
Yes. So in more severe cases of the disease, or in cases where an EMG or a special test known as a nerve conduction study, where it shows that the condition is very severe or the muscles in the hand are starting to lose control or function, you sometimes have to do surgery. Surgery might also be indicated in scenarios where non-surgical treatment doesn't work, and what you do is you take pressure off the nerve or sometimes move it to a different location in the front of the elbow.
That's pretty scary though, because once you already have this pain, you feel like it's kind of too late, but you're saying that it's curable.
Yes, it's absolutely curable. It all depends on how severe the condition is. The surgery is outpatient surgery, and in fact, I don't even put any restrictions on my patients. I allow them to full use of their hand immediately after surgery.
How long is the surgery process?
The surgery is outpatient and usually takes anywhere from half an hour to an hour.
And the recovery, you're saying you walk out the door,
you
you're
walk
fine,
out the door
you can
with
use your cell phone.
You can use your cell phone, you have a simple bandage on your elbow, and I allow my patients to do most activities within reason.
So what's your one piece of advice for people that are not using hands-free, they're actually talking on the cell phone?
A hands-free is a great idea. Having your elbow bent all day, being on a cell phone all day, or having your elbow bent while you're typing and things like that, if you have that narrow tunnel, you might have this problem.
Okay, Dr. Pervaiz, thank you so much for joining
You're
us.
welcome.
Do you think you could be suffering from cell phone elbow? Call the professionals at Orthopedic Associates of Central Maryland at 410-644-1880 to schedule your appointment today.